Have you ever had chicken pox? Chances are that you have, and that means you could be at risk of getting shingles. Shingles is a painful disease that is most prevalent in people over 50, which makes it extremely important that anyone in this age range knows more about the disease. Joining me now to speak with us about shingles and what we can do to prevent and treat this disease is Rebecca Hall, a family medicine advanced practitioner with Baptist Medical Group. Thank you for being here.
Thank you so much for having me.
Well, tell me a little bit about what is a family medicine advanced practitioner, and I believe you're involved with the opening of a new practice.
I am a board certified family nurse practitioner for the past 16 years, and my husband and I are empty nesters and have relocated to Pensacola in December, and I have joined Baptist Medical Group and will be opening a new family practice clinic in Perdido. So we welcome all new patients and walk-ins. We'll be starting on March 31st.
Well, we welcome y'all to Pensacola.
Thank you so much.
Well, let's get into this. Tell me a little bit about shingles. I mentioned chicken pox in the lead-in. Tell us what we're talking about here with shingles.
Shingles is caused by the varicella-zoster virus, which is the same virus that causes chicken pox. You cannot have shingles if you have never had chicken pox. Once the virus has resolved, it remains in our body for a lifetime and lays dormant or in an inactive state at the base in the nerve roots in the spinal cord. For reasons unknown, the virus can become reactivated, and when it does, it presents as shingles. Typically, the virus will follow a nerve pathway all along the spinal cord. There are levels, and each level has specific nerves that are responsible for a certain part of the body. So in most healthy people with a normally functioning immune system, that virus will follow that pathway all the way around and eventually end up in the nerves on the skin, and that is when the rash will develop. Rarely does the rash cross the middle of the body, and rarely does it affect more than one area in someone who has a normal immune system. And I'll talk a little bit later about why that's important. It's not uncommon to maybe see a little bit of the rash directly above or below that pathway, maybe a few little lesions on the other side of the body, but typically it stays on one side of the body.
Well, what does it look like? Does it look like the chicken pox would look when a child has that, or does it take on a different variation?
Early on, it can mimic several other infections, such as the herpes simplex virus that is responsible for cold sores, but can also cause lesions on the skin. Poison ivy, very close resemblance in the initial stages, and even bacterial skin infections. And many times this will delay a person seeking treatment because they're not thinking that it's shingles, which is a much more serious disease. So it starts out really more as a red, raised, painful rash that will then evolve through stages of being a vesicle, which is a fluid-filled lesion, to a pustule. It will break open and ulcerate and eventually scab over. And that process takes typically 2 to 4 weeks for that to occur.
Are there any other symptoms that someone, is there fever, anything like that might accompany what the visual would be?
Some people, the most common symptom is the rash. However, some folks will have what is called a prodrome, or a period of several days prior to the development of the rash where they may experience a fever, chills, headache, or upset stomach. And many people will experience pain, tingling, or itching at the site where the rash will eventually develop. And all of that usually happens in a period of 1 to 5 days before the rash develops.
Okay. Well, we've talked about, obviously, chicken pox and the increases with age, but are there any other risk factors that might be involved?
Natural aging is a risk factor. As we age, we experience immunosenescence, which is a gradual decline in our immune function, which as older adults definitely puts us at greater risk for infections like shingles and pneumonia and serious complications from influenza. Also, patients that are immunosuppressed or have an immune system that doesn't function normally. Those that are on certain medications that suppress the immune system, those that have cancers such as leukemia or lymphoma, HIV, patients on medications for organ transplant rejection, or medications used to treat autoimmune diseases such as rheumatoid arthritis or lupus have a suppressed immune system, so they are at much greater risk of developing shingles.
Well, obviously there is some treatment available, but the best thing would be to prevent it. Tell me a little bit about the vaccine, what age is recommended now. I know there was a recent change in the last year or two about the age that's recommended. Tell us a little bit about how we can prevent that.
There is a FDA-approved vaccine called Zostavax and is specific for shingles. It has been licensed now since 2006. It is the only thing that will prevent the risk of developing shingles or post-traumatic neuralgia, which is a painful disorder that can follow shingles. The vaccine is approved for all adults over the age of 60. Actually over 50. However, the current recommendation in this country is that all adults, unless contraindicated, have the vaccine at age 60. It has been proven to be very effective, most effective in the 6th decade of life. However, there's no maximum age to give the vaccine. It does not matter whether you have a history of chickenpox or whether you've had shingles before. It has been shown to reduce the risk of contracting shingles by about 50%. And they reduce the risk of post-traumatic neuralgia by about 2/3. So
is this something that needs to be done every year, every few years, or is one vaccine
It is a
sufficient?
one-time vaccine and is a very safe vaccine. There have been no serious problems associated with the vaccine. The most common reactions are usually local, maybe a little redness, swelling, warmth at the site of the injection. Occasionally, there may be a few chickenpox lesions at the site of the vaccination. It's advisable to keep those covered until they are resolved. One of the important things is it's not necessary to stay away from people. You cannot transmit shingles or chickenpox after having had the vaccine. The only people who would be at risk of developing chickenpox would be someone who has never had chickenpox that comes in direct contact with a patient with shingles, not someone who's had the vaccine.
Well, great. Well, before we run out of time here, if our viewers have any questions or concerns or see something, what would you recommend that they do?
I absolutely recommend that they talk with their healthcare provider anytime they have any suspicion that they could possibly have shingles. The sooner they see their provider and get treated, the better the results will be.
Well, great. Thank you. That's wonderful information. I know it's very, very painful.